Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Cleft.
Oh, sorry.
You can see.
We'll tell you when.
Okay.
I've never had someone do that. That's good.
You want to do the intro? Yeah, I could just say,
No, go ahead. Go ahead.
Go ahead.
Start all over.
Yeah.
Welcome back.
Hold up. Rick is starting over again, too.
Okay, go ahead. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Cleft lip and cleft palate are among the most common birth defects, resulting in openings or splits in the upper lip, the roof of the mouth, called the palate, or both. Cleft lip and cleft palate result when facial structures that are developing in an unborn baby don't completely close.
Having a baby born with a cleft can be upsetting to the parents, and I'd say grandparents too. But cleft lip and cleft palate can be corrected. It's done with a series of surgeries to restore normal function and achieve a more normal appearance with minimal scarring. Here to discuss treatment for cleft lip and palate is Dr. John Volz. Dr. Volz is an orthodontist in the Cleft and Craniofacial Clinic at Mayo Clinic. Welcome to the program, Dr. Volz.
Thank you. Thank you.
Dr. Volz, nice to meet you. Nice to have you on the program.
Thanks.
You know, we all know somebody with cleft lip or cleft palate, so it seems like it's a fairly common problem, but how common is it really in the U.S.?
Usually about 1 in 700 births are cleft palate or cleft
That's pretty
lip.
common. Is there anything more, any birth defect more common?
No, I think this is about the most common of all of them.
Top of the list.
Yes.
And
Craniofacial problems.
Is it a genetic problem? Is it a birth defect? What exactly is it?
Some are syndromic or genetic. Other ones are just spontaneously happen.
so does it tend to run in families? If one of your parents has had a cleft lip or palate, are you more likely?
Not necessarily. It just depends if genetically based or just a common happening during the gestation period.
Is with more prenatal care this generation and then previous generations or the last few generations, are there less cleft palates, cleft lips?
I don't think so. I think because it happens so early in the process that sometimes you don't even know you're pregnant and when it could be happening already. The cleft palate and lip are developing, yeah.
Now, the ultrasound of the newborn, of the fetus, they've gotten so good. Are you able to detect a cleft lip and palate before birth?
Those 3D ones that you can see.
About the 16 to 20 weeks into the pregnancy, they can do the ultrasounds, and they're pretty distinctive. It's got to be at the right angle, and sometimes you still miss them, but it's really helped a lot to prepare the family and get them ready and get them over to us, because a lot of times we're going to be doing things right after birth for the cleft palate and cleft lip.
Oh, you are?
Is it better for recovery to do this surgery right away, or why not wait a little while?
Well, the surgery usually for the repair of the cleft lip is usually done about 12 to 20 some weeks, but we do some pre-surgical modeling or molding of the palate and the lip. Previous to that, right after they're born, we usually take an impression about maybe 2 to 3 days after they're born if we can, and we start the process of molding the lip and the pieces in the palate together.
Always in preparation for the ultimate surgery that's required. I mean, there's no other treatment for this.
There's other things that it can do. They can do lip adhesions and things like that. But nowadays, it's more common probably to do the NAM appliance, nasal alveolar molding appliance, which is a little like denture device that we manufacture, and we kind of mold the child's developing arches together and then make it kind of close that cleft site down so the surgeon could do a better job with the lip repair. They're not stretching that tissue quite as far.
I would imagine the lip repair isn't as invasive as the palate repair.
No, the palate repair does come a little bit later, like 10 to 12 months after the child is born, the palate repair, but the lip repair is done pretty much 12 weeks or so after the child is born.
Now, does an orthodontist do all of this, or is plastic surgery involved? Or are you a one-man show? Or
No, this is definitely a team effort from start to finish. I mean, it's from birth, maybe before birth, preparing the individuals and the family, and all the way up until 18, 20 years old that the team is working together at different points. And it's staged. It's not a continuum. It's definitely kind of staged. Each member has a different involvement, and we try to team up and do things that maybe require surgery. You want to keep the surgeries to a minimum, so we try to do surgeries that maybe fall back on one another. Where ENT could do something, put ear tubes in, they could do the lip repair, they could do other things along the way and do it in one surgery instead of having multiple anesthesias and things like that.
What types of problems, so we've said, there's the cosmetic ramifications. I don't know if that's the right word to use, the cosmetic effects, but what kind of problems does a cleft palate present for a child?
Feeding is probably the biggest thing because a lot of times there's no palate, so they have to use different types of bottles to feed. The parents have to use different types of bottles because there's no palate to push against with their tongue to get the formula or the milk into them.
So the palate is the roof of the mouth.
Right, there's a roof of the mouth, exactly. Okay. Yeah.
Huh. And so the biggest problem is feeding early on.
Exactly. Right away is the big thing to start gaining weight and get them out of the hospital. So some of them will take a couple days to get out of the hospital, where normally you could be gone maybe within a day or two. Some are there a couple weeks until they can get their body weight up and they're not losing.
And I assume that this is not a problem that we only see in the United States. There must be other countries where a cleft palate develops in newborns that aren't as fortunate as the kids here who can get it repaired. What happens if it's never repaired?
Really, I think it's more as kind of psychological or social type of thing, because really if you just let the cleft lip and cleft palate go, growth will be better. Speech probably, however, will not be. That's the main thing about the palatal closure, the lip repair, is getting the person to be able to speak right away in those first 2 to 3 years. And that's why we have a speech pathologist or speech therapist on the team with us, because that's the first couple of years they're really trying to get that going along so they can speak and hear. Ear tubes have to be placed sometimes so the patient can gain language skills pretty quickly. Otherwise, they fall behind pretty quickly, and then by the time they're in kindergarten or so, they're going to be behind the curve with the other individuals.
We have been doing multiple dental type of topics in anticipation of the anniversary of the dental program here. Or how should I say that? The dental...
Centennial?
The centennial.
Celebration, yep. 100th.
The 100th, the centennial celebration. What has changed? I'm not saying that you've been here for all 100 years by any means, but over the course of your practice, how has this changed repairing the palate and the lip?
I think so. I think the more involvement with the nasal alveolar molding appliance. Before, when I first got here, we used an appliance that was surgically done, where we put it in place in the surgery. There'd be a surgery done. We'd actually place it in the patient's mouth during the surgery, and the parents would turn it, and it would kind of close, bring the segments together. However, we didn't have the option of kind of molding the nasal part of it.
So the nasal is nose, but then you alveolar. What is
alveolar is taken, your upper jaw is kind of an arch form, and when the cleft is there, that arch form could be broken down into 2 pieces, one that's a little bit larger, or it could be broken down into 3 pieces, where you have 3 pieces. The premaxilla, where your anterior teeth are, your laterals and central incisors are all forward out of the mouth. They're protruding out. So what you're trying to do is bring that back into the mouth and kind of get it ready for the lip repair.
All right. Did you really run the Boston Marathon?
Yes, I did. This year.
How good for you was it cold?
It was cold.
But you did
monsoon rain and a wind coming at you about 37 miles an hour.
Is this the first time you've done it?
First time I did Boston. I've done 30-some marathons before.
Well, congratulations.
He's my hero.
Yeah, I guess so. All right, cleft lip, cleft palate with Mayo Clinic orthodontist Dr. John Volz. Thanks so much for being with us. Pleasure meeting you.
It was a pleasure doing this. Thanks.